Veena, just welcome. On the screen share in the
screen share.
I'm just saying, okay, just
okay. Screen.
Okay, stop it. Okay.
Video on channel.
Kavya on Chidolo. Veena video video. One no, I depend on
share video.
Share in the Munne Matron, welcome to the summit one.
Okay. Okay. Okay.
Okay, last welcome in the time.
Okay. Okay. That's why you share a video off.
Okay.
Okay.
Appa eniki video off cheyalalle.
Cheyan.
Okay. Appo doctor ഇത് പറയുമ്പോഴേക്കും ഞാൻ ഓൺ ചെയ്യാം.
I think we can start, okay.
Can I start?
Yeah, please.
A warm good evening, one and all. I'm Dr. Kavya, welcoming you all to a new webinar series, Inspire 2022 by IHMA Kerala School of Homeopathy. Let me give a few words about SOH, a subsidiary of IHMA Kerala. The academic wing of IHMA takes care of the coaching and training for competitive exams like PSC, AIAPGET, etc. through CECP, that is Competitive Examinations Coaching Program, and MOST, that is Medical Officers Structured Training. School of Homeopathy has also released guide comprising of 2 volumes named iBasic to help competitive exam preparations. This guide has already acquired the best status among the students and practitioners alike. School of Homeopathy also supervises regular continued medical education programs for the members by arranging seminars with competent faculties in the field. Next, I am giving a small introduction about TORCH, that is training and orientation for competitive exams. For those who cannot afford a long-term coaching, Torch is held in each year, which is an intensive 7 days in-house coaching program. This year also, we are conducting Torch as a 5-day residential coaching program from August 3rd to 7th. Here we provide regular classes by eminent faculties, daily mock exams, and also free access to 3 All India Model AIAPGET tests conducted by IHMA. Preparation for a post-graduation is no child's play. Questions about what to do, how to do is dilemma to many. Today, we have an apt person to help you out of this dilemma. Dr. VEENA T. BHMS, who earned a stellar third rank in AIAPGET 2021. Let us hear her inspiring and motivating story in the journey of Year 3. Her preparation strategy, study timetable, books she referred, useful study tips for AIAPGET 2022, mistakes one should avoid while preparing for competitive exams in homeopathy. So, everyone, I am welcoming Dr. VEENA T, who completed her BHMS from National Institute of Homeopathy, Kolkata, and pursuing her MD in Practice of Medicine at Nehru Homeopathy Medical College. Welcome, Dr. VEENA.
Thank you, Dr. Kavya, for such a warm welcome. Myself, VEENA, from I have completed my UG from NIH Kolkata. Currently, I am doing my PG in practice of medicine from Nehru Homeopathy Medical College, Delhi. And thank you IHMA for such an opportunity also. So let's begin our session.
Carry on.
The screen is visible now.
Yes, yes.
Okay. So last round preparation for AIAPGET 2022. So these are the topics I am dealing today. First, analysis of number of questions from each subject in the year 2020, 2020 and 21. Important topics from each subject. What are the books you have to refer? Study tips, strategy for preparation, mistakes to be avoided by aspirants, frequently asked topics, and lastly, how to avoid negative. So let's start our session. First, number of questions from each subject in AIAPGET of previous year. So we already know we have 12 subjects. Let's see importance of each subject and number of questions from each subject. In the year 2070, before 2070, there were separate exam for each state, like Kerala. For Kerala, there was one separate MD exam. For West Bengal, there was separate exam. From 2017 onwards, this All India exam has been started. So in the year 2070, number of questions from Organon of medicine were 10 questions. From Materia Medica, 20 questions. From Repertory, 9. From pharmacy, 5 questions. Medicine physiopatho, altogether 32 questions. Gynae and Obs, 5 questions. Surgery, 7 questions. PSM, 4 questions. FMT, 2 questions. And lastly, anatomy, 5 questions. Here in the year 2070, they have given now 2018. Organon of medicine.
Dr. VEENA, can you go a little bit slower?
Okay. So in the year 2018, from Organon, there were 13 questions. From Materia, there were 15 questions. From Repertory, 70 questions. In the previous year, in 2070, from Repertory, only 9 questions were asked. In 2080, it has been changed to double. Okay, almost double. Repertory, 17 questions. Okay. Then pharmacy, 5 questions. Medicine physiopatho, altogether 19 questions. Gynae and Obs, 11 questions. Surgery, 9 questions. PSM, 3 questions. FMD, 2 questions. And lastly, anatomy, 3 questions. Next, in the year 2090, from Organon, only 8 questions were asked. From Materia, 14 questions. From Repertory, 12 questions. From Pharmacy, only 3 questions. Medicine, Physio, Patho, altogether 27 questions. From Gynae and Obs, 10 questions. From Surgery, 6 questions. From PSM, 5 questions. From FMD, only 3 questions. And from Anatomy, 6 questions. Next, in the year 2020. 2020 from Organon of Medicine, 8 questions. From Materia, 14 questions. See, from Repertory, almost 20 questions were asked. And Pharmacy, only 2 questions. Medicine, Physio, Patho, altogether 24 questions. Gynae and Obs, 11 questions. Surgery, 9 questions. FMD, 6 questions. PSM, 6 questions. And lastly, Anatomy, 8 questions. Now, in the year 2020, year, Medicine, 10 questions. Materia Medica, 16 questions. Repertory, 17 questions. From Pharmacy, only 6 questions. Medicine, Physio, Patho, altogether 26 questions. Gynae and Obs, 9 questions. Surgery, 9 questions. FMD, 3 questions. PSM, 5 questions. And lastly, Anatomy, 9 questions. So, in the year 2021, almost 61 questions were asked from the allied subject. And they have given equal weightage for both allied subject and both homeopathy subject. 60 questions from allied subject and 60 questions from homeopathy subject. So, there is no fixed pattern. Okay, there is no fixed number of questions for each subject. There is no fixed weightage also. Sometimes they give equal weightage, sometimes they give more weightage to allied subject. Okay. So, importance of each subject. The primary importance should be given to homeopathy subject. Among homeopathy subject, most important one is Materia Medica, then Repertory, then Organon of Medicine, then Pharmacy. Suppose if you are studying for 8 hours, only for if you are planning to give 8 hours for homeopathy subject, then divide your timetable as 4 hours for Materia Medica, 2 hours for Repertory, 1 hour for Organon, and rest 1 hour for Pharmacy. Okay. So, among homeopathy subject, Materia and Repertory are the most important one. Okay. Then, among allied subject, medicine is the most important one. So, here I have mentioned medicine, physio, patho all together. Because if you are planning to study one chapter from general medicine, try to study same chapter from the physiology point of view and from the pathology point of view. For example, if you are planning to study CVS from general medicine, then study CVS from general medicine first, then study the physiology part and then pathology part. It is a better way of studying and understanding medicine. Next weightage should be given for gynae and obs and next surgery. Again PSM and FMD and lastly anatomy. Now important topic from each subject. First is Materia Medica. Primary book for Materia Medica is Alan Skinner. If you can remember each and every, if you can by heart each and every sentence from Alan Skinner, it is very good. If you cannot by heart also, it's okay, but you should have an idea regarding what are the symptoms are there in particular drugs. Okay, at least you should study this point. Bold line symptoms from Alan Skinner, relationship sections from Alan Skinner, aggravation and amelioration. Very important one is time modality. For example, 4 to 8 p.m. aggravation, 3 a.m. aggravation, 3 p.m. aggravation. So this kind of time modality is very much important. Then common name and family. Sometimes there were multiple common names for a single drug. So try to remember all the common names. So I have given some examples of time aggravation. Arsenicum album 1 to 2 a.m. or 1 to 2 p.m. aggravation. Calica 2 to 3 a.m. aggravation. Lycopodium 4 to 8 p.m. aggravation. Thuja 3 a.m. and 3 p.m. aggravation. Natrium 10 or 11 a.m. aggravation. Next is provers. Provers are also important. So one example, Samuel Hahnemann has proved aconite, alumina, arca, belladonna, nux vomica, etc. JT can prove Cenchrase, Vespula vulgaris, Vaithia. Herring proved allium cepa, calmia, lycinum, selenium, pteridine. Staph proved Anacardium orientale, Platina, Sabina, and lastly Crocus. Some confusing common names. See, St. John's wort is Hypericum. St. Mary's thistle is Carduus. Poison nut is Nux vomica and poison ivy is Rustome. This poison nut and poison ivy is little bit confusing. How I remembered was in poison nut N and in Nux vomica also there is N. So poison nut is Nux vomica. Then automatically poison ivy will be Rustox. Okay. Black hellebore is Helleborus niger. White hellebore is Veratrum album. Poison hemlock is Conium. Water hemlock is Cicuta. Bearberry is Berberis vulgaris and baneberry is Actia spicata. Now families. Under composite family medicines are Abaca, Cinna, Chamomilla, and lastly Millefolium. Liliaceae family Allium cepa, Allium sativa, Aloe, and Sabadilla. Ranunculaceae family Adonis vernalis, Aconite, Staphylos agria, and Pulsatilla. Under Solanaceae family Belladonna, Dulcamara, Tabacum, and Stramonium. Under Euphorbiaceae family Acalypha, Croton teak, Viburnum, and Mancinella. So here I have included some questions also. I have taken this question from Ellen Skinotoli. Tongue cold, flabby, trembling. The correct option is camphora. Aversion to open, dry, cold air. Correct one is carbo animalis. One hand icy cold, other warm. See, here option A is digitalis, option B is ipecac, option C is pulsatilla, and option D is all of the above. Actually, this particular sentence, symptom is given under ipecac, and under ipecac, digitalis and pulsatilla are given in brackets. So will be option D, all of the above. So while attending MCQs or any other exam, first read the question thoroughly, then read the options thoroughly, then go for answering. Okay. Hasty eating and drinking. Option A, belladonna. Option B, heifer. Option C, coffea. And option D, all of the above. Correct option is option D, all of the above. Actually, I think this sentence is given coffea in Ellen Skinner. Next is daily colic of infants at 5 a.m. I already told time aggravations are very much important. Correct remedy is calibrome. Transverse colon protrude like a pad. Options are China, Bismuth, C, belladonna, and D. So correct one is belladonna. Diarrhea before menses. Option A, amount carb is the right answer. Here see diarrhea before menses. Okay, it's not constipated, it is diarrhea before menses. Next is sensation as if anus is open, present in. Correct option is option B, phosphorus. Symptom constipation before and during menses is indicative of option A, Amoncar, option B, Veratrum album, option C, Silesia, option D, Bovista. Correct option is option C, Silesia. See the question once again. Here it is constipation, not diarrhea. Constipation before and during menses is Silesia. If it is diarrhea before and during menses, then it will be Amoncar, Bismuth, and Veratrum album, etc. Diarrhea like dirty water from fruit, sauerkraut is seen in. It is correct option is bryonia. Constipation of infants during dentition is characteristic of. Okay. Remedy is Macmure. Now, boring Materia Medica. Next important book for Materia Medica is boring Materia Medica. It is very hard to remember each and every line from boring Materia Medica. At least you should have idea regarding these things. Symptoms written in italics under each drug, introductory portion of each drug, and the relationship section of each drug. So let's see some questions from boring Materia Medica. According to William Borey, this remedy can be given when pulsatilla fails in schoolgirls. So I think this sentence is given under pulsatilla under the relationship section. Okay, so the correct answer is Calcarea car. Which is the most suitable remedy for profuse watering from eyes after extraction of cinders and other foreign bodies? Correct option is A, aconite. Golden yellow coating of tongue. Option is B, natrum force. Cool sweat on face, especially around the mouth and nose. The correct one is not natrum, it is room. Option B, room is the correct answer. Stertorous breathing and hot perspiration all over the body except lower limb are symptoms of. Option C, opium. Tendency to abscess after fevers. It is phosphoric acid. Burning of lower lip of smokers. Option A, bryonia. Warts on glands. Option A, andum tart. Headache relief by conversation. It is dulcamara. Pain in left floating ribs. It is pterygium. Now, repertory. So, whole repertory subject can be divided into two parts. One is theory part and next one is different type of repertories. Under theory part, the important topics are origin of each repertory, type of repertory, early repertories with dates and name of authors. Okay. Then coming to the repertory proper, then three repertories are very much important. One is Ken repertory, next is BTPV and the other one is BBCR. So, among these repertories, these are the important points. Date of publishing, edition, different edition and changes in each edition, number of chapters, total number of rubrics, single remedies and reference. So these are the important topics from repertory. Other repertories, other important repertories, Bode repertory, Bell's diarrhea, synthesis repertory, synthetic repertory, Murphy repertory, Gentry repertory, Nur repertory, Robert sensation assay, symptom register, repertory of intermittent fever, and lastly repertory of fever. Okay, the important points are date of publishing of these repertories, number of medicine under each repertory, gradation of each repertory, typography used in each repertory, different editions with number of medicines and character of each edition, then chief features of these repertory. For example, Gentry repertory is a concordance repertory. Symptom register is an alphabetical repertory. So these points are important. Now, some questions. Last chapter of synthesis repertory. Last chapter of synthesis repertory is option A, generals. Concordant repertory of Gentry has dash volumes. Okay, concordance repertory has 6 volumes. Gentry's repertory has dash number of gradation. Only one gradation or no gradation. Okay, so one is in the option. So option will be option A, one gradation. Nur repertory is based on Herring's guiding symptoms. Synthetic repertory has been compiled from dash number of sources. So synthetic repertory compiled from 16 sources. Author of Repertory of Intermittent Fever. Repertory of Intermittent Fever written by W.A. Allen. Volume 1 of synthetic repertory contains. Synthetic repertory having 3 volumes. Volume 1 contains mind. Number of gradation in repertory of Bode. It is 2 gradation. One is italic and next one is Roman. Typography used is italic and Roman. Author of Repertorium Homeopathicum Syntheticum. It is the name of synthesis repertory, not synthetic repertory. Repertorium Homeopathicum Syntheticum is synthesis repertory. Okay, synthesis repertory written by Frederick Stroens. Okay, we have 2 repertory. One is synthetic and one is synthesis. How I used to remember was synthesis means there is S in it. So in Frederick Stroens also there is S. So synthesis by Frederick Stroens. Okay, and automatically synthetic by Berthel and Clunker. Year of publication of first Indian edition of homeopathy medical repertory. See, let's see the question once again. First Indian edition of homeopathy medical repertory published by Murphy, Robin Murphy, Indian edition. They have asked regarding the first Indian edition. First edition of homeopathy medical repertory came in 1993. Okay, first Indian edition in 1994. So first read the questions thoroughly, then read the option and go for answering. Okay. Next is Organon of medicine. So Organon of medicine, these are the important topics. First is aphorisms. Okay, aphorism, number and gist of each aphorism are very much important. Then the introduction part of Organon, different editions of Organon and date of each edition and character of each edition. Then under history, discovery of homeopathy, life history of Hahnemann, other eminent homeopath like Ken, Bornehusen, etc. Then the philosophy. To go through the entire philosophy book, there are important topics. Some of them are Ken's 12 observation, obstacles to cure, susceptibility, aggravation, amelioration from Robert and Ken philosophy book. And miasms are also important. Now coming to the pharmacy part, these are the important topics in pharmacy. First is pharmacopoeia. Different pharmacopoeia with date of publication in homeopathy of different volumes with number of monographs. Then sources of drug, different classes of drug and drugs under each class. First class, second, third, fourth. Okay. Method of preparation, different type of scales, prescription writing, parts used for preparation of each drug, and measurement. Measurements mean 1 fluid gram is equal to dash ml, 1 fluid ounce is equal to dash ml, 1 drop is equal to dash fluid gram. Okay, these are the conversion of measurement. So these are important. Now, among the allied part, medicine is the most important topic. So these are the important topic under medicine. CVS, GI system, respiratory system, endocrinology, skin, central nervous system, expiratory system, and lastly, rheumatology. Then most important topic from CVS is murmurs. Type of murmurs, then heart block, then angina, then MI, rheumatic fever, mitral stenosis and mitral regurgitation, aortic regurgitation and aortic stenosis, congenital heart diseases. Among congenital heart diseases, important ones are atrial septal defect, ventricular septal defect, pathology of fat, coagulation of aorta, and lastly, patent ductus arteriosus. Next is GI system. These are the important topics from GI system. One is peptic ulcer, then irritable inflammatory bowel disease and irritable bowel syndrome. Under inflammatory bowel disease come ulcerative colitis and Crohn's disease. Then tropical screw, Whipple disease and celiac screw. How to differentiate between these three. Then CA stomach, signs of CA stomach are important. Then pancreatitis, both acute and chronic pancreatitis. Now the important topics under respiratory system are COPD, bronchial asthma, CA lung, TB, bronchiectasis, pneumonia, pneumothorax, cystic fibrosis, and lastly sarcoidosis. Now endocrinology, hyperprolactinemia, diabetes insipidus, diabetes mellitus, goiter, thyroid, pheochromocytoma, and multiple endocrine neoplasia. Now coming to the skin, these are the important topic. Different layers of skin with psoriasis, leprosy, vitiligo, eczema, pityriasis, lichen planus, and conditions of hypopigmentation and hyperpigmentation. Now, the CNS part, headache, different type of headache, and investigation under each type, character of each type of headache. How to differentiate between two type of headache. Epilepsy, Parkinson's disease, multiple sclerosis, meningitis, Alzheimer's disease, and lastly, motor neuron diseases, upper motor neuron disease and lower motor neuron disease. Next is myasthenia gravis. Now the excretory system, these are the important topic. Nephritic syndrome, nephrotic syndrome, renal failure. How to differentiate between nephritic and nephrotic syndrome. Next, rapidly progressive glomerulonephritis, hematuria, and CAS. Different type of CAS and in which condition this type of CAS will be found. Then rheumatology part, osteoarthritis, gout, RA, rheumatoid arthritis, psoriatic arthritis, reactive arthritis, ankylosing spondylitis, SLE, systemic sclerosis, vasculitis, Takayasu arteritis, PAN, Goodpasture syndrome, and Henoch-Schönlein purpura. Now coming to physiology and biochemistry part, all the system I have mentioned in the medicine part are important in physiology point of view also. So all the system like respi, cardio, skin, etc. Apart from these system, the important topics are blood, different type of hormone, different type of enzymes, activity of these enzymes, from where this enzyme originated. So all these points, transport across cell membrane, and lastly spatial senses. Now coming to the surgery part, the important topics are burn, wound healing, arterial disorders, venous diseases, piles, fissure, fistula, skin cancers, boils, carbuncle, erysipelas, and cellulitis. Then breast, adrenal gland, thyroid gland. This breast, adrenal gland, thyroid gland, these are favorite topic of examiners. Then oral cavity, renal stone and gallstone, and hepatobiliary system, different type of hernias. Now coming to
Dr. VEENA.
gynecology.
Hello.
Hello.
Dr. VEENA, can you just show the respiratory slide?
Respiratory. Okay, 1 minute.
Thank you.
Shall I move forward?
Yeah, definitely. Yeah.
Coming to gynecology and obstetrics, these are the important topics from gynecology part. First is anatomy of female genital tract, then menstrual disorders, menopause, pelvic inflammatory diseases, endometriosis, adenomyosis, genital TB, carcinoma, different type of carcinoma like CA cervix, CA ovary, CA uterus, and CA endometrium, fibroid and PCOD, lastly prolapse and fistula. Next is obstetrics. Obstetrics, these are the important topic. Physiological changes during pregnancy, antepartum, postpartum hemorrhage, labor, puerperium, ectopic pregnancy, complications of pregnancy, placental abnormalities, contraceptive method, and lastly, assistive reproductive techniques. Now, PSM and FMT. Under PSM, important chapters are epidemiology chapter, screening of disease, different indicators of health, communicable and non-communicable diseases, demography and family planning, environmental health, occupational health, nutrition. Under nutrition, vitamins and their deficiency disorders are very important. Then under statistics, different type of graph, mean, mode, and median. Okay. Under FMT, important topics are identification chapter, post-mortem changes, autopsy chapter, medical laws and ethics. For example, medical, what is medical negligence? What is dichotomy? What is okay. Then injury chapter, mechanical injury, firearm injury, blast injury, thermal injury, etc. Then asphyxial death like hanging, strangulation, suffocation, etc. Different IPC sections, Indian legal system like type of court, power of court, dying declaration, dying deposition, etc. Most important chapter in FMT is toxicology chapter, different signs of poisoning is coming to anatomy. Okay. Anatomy is a vast topic. It is very difficult to remember each and every point from anatomy. At least you should remember these topics. Okay, from upper limb, these are the main topics. Upper limb, the main topics are brachial plexus, cubital fossa, carpal tunnel syndrome, anatomical snuff box, carpal bone, origin and attachment of some important muscle, flexor retinaculum, extensor retinaculum, lumbricals and interossei. Under lower limb, important topics are femoral triangle, femoral canal, adductor canal, tarsal bones, compartments of thigh and leg, and lastly popliteal fossa. Under thorax, mediastinum and structure, supply of heart, ribs, lungs, and aorta. Under brain and neck, brain, triangles of neck, and lastly cranial nerves. Under abdomen chapter, regions of abdomen, peritoneum, mesentery, abdominal aorta, inferior vena cava, peritoneal body, perineum, and ischiorectal fossa. Under ENT, complete anatomy of ear, anatomy of nose, pharynx, Waldeus ring, laryngeal muscles, and lastly muscles of tongue. These are some miscellaneous topic from anatomy portion. Different types of epithelium, different type of joints, different type of cartilages, ossification of bones, primary ossification center, secondary ossification center, embryology, spinal cord, spinal nerves. Fractures are important in anatomical point of view and also in surgical point of view. Then skull bones, facial muscles, prostate, spermatic cord, ligaments of uterus and supports of uterus. So these are the important topics. Now books to refer. Okay, so before going to this slide, what I have to tell is now you guys are having only 1.5 months. Okay, so no need to change your book. Okay, stick to those books which you are following now. Okay, and no need to study multiple book. Also stick to 2 or 3 books. Okay, no need to study more than 3 books. Okay, so let's see what are the important books you have to refer. So first one is Success, all the 3 volumes. Second is PG Plus. Next is Mudit Khanna. Mudit Khanna is only for practice of medicine. ROMS for allied subject. Crack the entrance for Materia Medica. Jana for now I used to refer Success, all the 3 volumes, and Mudit Khanna for practice of medicine, and also Crack the entrance for Materia Medica. Okay, so this Crack the entrance is a must buy book. Okay, it is a good book for Materia Medica. If you have this book, go through the book. If you have this, then go through the book thoroughly. If you don't have this, no problem, go through Allen and go in Materia Medica. Okay, we have some other books also of IHMA, then Kason, Point, and lastly VK Chauhan. Okay, so VK Chauhan is a good book during your revision time. Okay, because this book contains so many question papers with proper explanation. So if you want to buy, you can buy this book during this time. Okay, so 1.5 months is left, so it will be a good choice for you guys. Okay, if you want, you can buy. If you don't want, it all depends on you. So now some study tips. Read homeopathy subjects every day. Okay, you have to read homeopathy subjects daily. Don't skip homeopathy subject. Okay. For allied subject, divide time on priority basis. So more time should be given for medicine, practice of medicine, then gynecology and obstetrics, then surgery, then anatomy, and lastly community medicine and forensic. Okay, so suppose you are planning to study for 8 hours, then you can give 4 hours for 4 hours for medicine, 2 hours 2 hours for surgery, 1 hour for anatomy, 1 hour for half hour for PSM, and half hour for FMT. Okay, this. Divide your time on your priority basis, and you should do at least 1 question or 1 online test series or 1 mock test daily. Okay, so you can do the question papers from any question banks like VK Chauhan, or from Success, or from PG Plus, any other books. Okay, and from online test series, for online test series there are so many some paid apps also. It all up to you. Okay, then most are available. Okay, so at least okay, if you can do 2, 3, 4 question papers daily, it's well and good. Okay, at least have to practice 1 question paper daily. Okay, revise the topics weekly. Okay, try to revise the topic in a weekly basis, otherwise you will forget everything. Make notes of your own while studying, so that revision will be easier. So while studying, try to make your own notes. Okay, if you are thinking that this note making will consume time, then while reading a book or while reading the coaching class note, try to highlight the points and go through those points which you are highlighted. Okay, no need to go through the entire book again and again. Okay, These are the important ones. Topic, some dates, IPC section, single remedy, family, common name, provers, classes, parts used, aphorism, numbers. Okay, what you guys can do is write these points on small sheet of paper and paste it in front of your study table or somewhere else, so that you can revise it daily. Okay, it's a better way of studying. Okay, so try to do it. Okay, only those topics which are frequently asked and those feel important. So only 1.5 months left. So it is not the time to enhance your knowledge. Okay, it is the time to study smartly. Okay, not hardly. It is time to study smartly and wisely. Okay, so study only those topics which are frequently asked and which you feel to be important. Okay, no need to study the entire book. It is waste of time. Don't waste your time by reading the whole textbook. Go through the question papers as much as you can possible. Okay, so then only you will understand how can you manage your time. Okay, if you are doing more question paper, then you will be acquainted with your time management. Okay, there is no shortcut for this time management. If you are doing so many question paper, automatically you will get acquainted with this time management. So go through the question papers as much as you can. For doubt clearance and extra point, you can go through the particular topic from authorized textbook. You should be thorough with Allen's keynote. For Materia, Allen's keynote is the primary textbook. Okay, so you should be thorough with Allen's keynote. If you can by heart it, it is well. If you cannot by heart also, it's okay. You should have a clear idea regarding under each drug. Okay, don't get confused with two symptoms. Okay. Give more time for those subjects in which you are weak. Okay, for me, medicine was a little bit tough, so I used to give more time for medicine. Okay, so like that, give more time for those subjects in which you are weak. Okay, while reading a topic, try to frame possible questions. You can do group studies, rubric hunting with friends, etc. It is all up to you which one you are preferring, group study or individual study. And you can make mnemonics also. If you can remember the mnemonics, it's well and good. Don't get confused between the mnemonics. Okay, so if you want, you can make mnemonics for easy remembering things. Now, strategy for preparation. Preparation today onward. It's hardly 1.5 months left. If you have not yet started your preparation, then start your preparation from today onwards. Okay, so 1.5 months is enough to acquire a good rank. Okay, so if you have not started your preparation, start your preparation with homeopathy subject first. Okay, spend about 8 hours daily. Okay, 4 hours for Materia medica, 2 hours for Repertory, 1 hour for Organon, and 1 hour for pharmacy. Okay, after completing homeopathy subject, study medicine, practice of medicine, then gynecology and obs, and cover surgery also. At least cover these 3 aligned: medicine, gynecology and obstetrics, and surgery. Okay, if you are giving your 100% in this 1.5 months, definitely you will get a good rank. Okay, those people who have already started your preparation, start your revision. Okay, it is a time for revision. Okay, so start your preparation, make your own timetable and study accordingly. If you are doing a clinic or interview, spend about 6 to 8 hours daily only for this preparation. When exam get closer, you have to spend more time. Start revision from 3 to 4 months before exam. Actually, it is 1.5 months left, so it is a time for revision. Okay, so try to do a fruitful revision. Okay, and a definite time for Materia medica every day, because Materia medica is a volatile subject. If you don't read it daily, you will easily forget it. Okay, and if possible, spend a definite time for medicine also. You should study homeopathy subject daily. For example, Monday you can study Organon, Tuesday Repertory. Likewise, you can make your own timetables. Okay, don't follow other timetable. Make your own. See, strategy of preparation varies from person to person. Okay, IQ level persons to person differs. Okay, like that, my strategy may not be your strategy. Okay, so try to make your own timetable, try to find your own strategy. Okay. Medicine, almost 6 to 8 revisions are needed. For practice of medicine, 6 to 8 revisions are needed. And for FMD, PSM, anatomy, biochemistry, biology, 3 to 4 revisions are enough. Homeopathy subject, you have to study daily. Medicine, 6 to 8 revisions are needed. FMD, PSM, anatomy, biochemistry, physiology, 3 to 4 revisions are enough. And for gynecology, OBS, and surgery, 4 to 5 revisions are enough. Okay. Practice MCQ. Suppose you are doing one question paper, then mark down those questions which you feel to be difficult. Okay, then again go through the question paper, then the second time only go through those questions which you are highlighted. Okay, no need to go through the whole questions again and again. Okay, practice MCQs as much as you can, mark down the difficult one
Veena, Dr.
and
Veena?
revise it.
Screen is sharing.
Hello.
Screen share ഉണ്ടോ?
Yes, yes.
ഒന്നുകൂടെ
Screen share
അത്
ചെയ്യുന്നുണ്ട്.
അത് പോയിട്ടുണ്ട്. ഒന്നുകൂടെ ഒന്ന് നോക്കൂ. ഇല്ലില്ല, ഒന്നുകൂടെ ഷെയർ ചെയ്യോ?
Okay, okay, okay. ഒരു മിനിറ്റ്. It visible.
ഇപ്പൊ കാണാം.
ഓക്കെ അല്ലേ? എവിടെ വരെ കിട്ടിയിരുന്നു?
എനിക്ക് തോന്നുന്നു മുന്നത്തെ സ്ലൈഡിൽ തുടങ്ങിക്കോ. കുറച്ചുപേര് ഇങ്ങനെ ചാറ്റ് ചെയ്യുന്നുണ്ട്, കുറച്ച് സ്പീഡാണ്. ബാക്കിയെല്ലാം ഓക്കെയാണ്.
ഓക്കെ, ഈ സ്ലൈഡ് തൊട്ടാ?
അതെ 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 അതെ.
ഈ സ്ലൈഡ് കിട്ടിയിട്ടേ ഇല്ല.
ഇല്ലില്ല, അത് തൊട്ട് തുടങ്ങി. കുഴപ്പമില്ല, അത് കുറച്ച് കിട്ടിയിട്ടുണ്ട്. കുഴപ്പമില്ല, അത് തൊട്ട് തുടങ്ങി.
Okay, 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 okay. So start your preparation today onward. If you have not started your preparation, if you have
Full
already
screen
started
ആക്കിക്കോ,
your preparation.
Full screen
എന്താണ്
ആക്കിക്കോ.
full screen? Okay, okay, okay.
ഇപ്പൊ സ്ക്രീൻ ഷെയർ പോയില്ലോ.
ഹലോ,
ഇപ്പൊ സ്ക്രീൻ ഷെയർ പോയി തോന്നുന്നു. എനിക്ക് തോന്നുന്നത് ഫുൾ സ്ക്രീൻ ആക്കുമ്പോ സ്ക്രീൻ ഷെയർ പോകുന്നുണ്ടെന്ന് തോന്നുന്നു.
ഞാൻ ഫുൾ സ്ക്രീൻ ആക്കിയിട്ടില്ല.
ഓക്കെ, കാവ്യക്ക് കാണാൻ പറ്റുന്നുണ്ടോ?
ഇല്ല, പറ്റുന്നില്ല.
ഒന്നുകൂടെ നോക്കൂ ജസ്റ്റ്.
ഒരു മിനിറ്റ്, ഞാൻ ഇടയ്ക്കിടയ്ക്ക് മ്യൂട്ട് ആയി പോകുന്നുണ്ട്. ഇപ്പൊ കാണാൻ പറ്റുന്നുണ്ടോ?
ഇല്ല.
ഒന്നുകൂടെ ഷെയർ ചെയ്യൂ. സ്റ്റാർട്ട് ചെയ്തോളൂ. അവിടുത്തെ റേഞ്ച് ഇഷ്യൂ ആണ്, വേറെ ഒന്നും അല്ല കേട്ടോ.
ഇപ്പൊ കാണാവോ?
ഇപ്പൊ കാണാം. ഓക്കെ.
Okay, so start your preparation from today onwards. If you have not started your preparation, if you have already started your preparation, then it is the time for revision. Okay, if you are doing clinic or any internship, then spend about 6 to 8 hours daily only for this preparation. When exam get closer, you have to spend more time. Start revision from 3 to 4 months before exam. Spend a definite time for Materia Medica every day because Materia Medica is a volatile subject. So you have to give more time for Materia and medicine, a definite time. Okay. You should study homeopathy subject daily. Monday, like for example, Monday, Organon of medicine, Tuesday, Repertory. Likewise, you can make your own timetable. Don't copy others' timetable. Okay, make your own timetable. Okay. For medicine, almost 6 to 8 revisions are needed. For FMD, PS, anatomy, biochemistry, physiology, 3 to 4 revisions are enough. Okay. And then for gynae and obstetrics, gynae, obs and surgery, 4 to 5 revisions are enough. Practice MCQs. Doing a down, highlight difficult questions and then go through the difficult questions again and again. No need to do the question paper. No need to the question paper fully again and again. Only go through the highlighted ones. Make your own timetable and study accordingly. What I used to do was before going to bed, I used to plan my next day. What are the topics to cover on next day? So this will help me in a study in a good way, and I used to stick on to that timetable also. So try to make your own timetable and try to stick on to that timetable. Okay, study accordingly. Try to your daily target of also. Then mistakes to be avoided by the aspirants. Don't put Materia Medica for the last moment. Okay, daily you have to study Materia daily. Study Materia Medica daily. Spend a fixed time for it. Make a habit of revising the drug before going to bed, either during your showers, either during eating, either listening to music, or either doing something else. But you have to revise the drugs again and again. Don't waste your time by studying the whole textbook. Okay. Frequent revisions are necessary for medicine. Otherwise, you will get confused with the options. Don't give undue importance to FMT and PSM. Okay. From FMT and PSM, altogether less than 10 questions will be asked. Okay. Don't give much importance to FMT and community medicine. If you are not sure about the answer, it is better not to attend it. Okay, try to avoid negatives. Okay, because sometimes negative mark matters. Okay, negative mark decide your rank also. Okay, so try not to attend if you are not sure about the answers. Of MCQ is a okay, I know to mug up the MCQ, you should have a base idea regarding each subject. Okay, so because now the questions are more in action level. It's so don't mug up the MCQ. Okay, try to understand the things. Frequently asked topics. These are the frequently
സ്ക്രീൻ ഷെയർ പിന്നെയും പോയിട്ടുണ്ടെന്ന് തോന്നുന്നു. ഒന്നുകൂടെ സ്ക്രീൻ ഷെയർ ചെയ്യാവോ വീണ? ഓക്കെ ആണ് സ്റ്റാർട്ട് ചെയ്തോളൂ.
Is it visible? Okay, അല്ലേ?
ആണ്
Hello?
ആണ് ആണ് വീണ, കുഴപ്പമില്ല.
Okay. So frequently asked topic. These are the frequently asked topic. Ken's 12 observation, vehicles, immunoglobulins, vitamins, supply of heart, miscarriage, chromosomal disorders, immune reaction, thyroid gland, vaccines, mosquito-borne diseases, different signs, pharmacy acts, and lastly contraception. So a few questions from these topics. 11, all symptoms reappear. Option B, observation is when all symptoms started reappearing. All symptoms started reappearing. Third observation, aggravation will be acute, short, and strong. Ken's dash observation is reappearance of all symptoms. So 11th observation is reappearance of all symptoms.
വീണ ഒന്നും കേൾക്കുന്നില്ല ആക്ച്വലി കേട്ടോ.
Milk is 1 unit levo, 1 unit beta from ചേട്ടാ വിസിബിൾ അല്ലേ സ്ലൈഡ്?
അതെ അതെ.
ഓക്കെ, എവിടെ വരെ വന്നിട്ടുണ്ട്?
ഈ സ്ലൈഡ് വെച്ച് തുടങ്ങിക്കോളൂ, കുഴപ്പമില്ല.
Okay. So burnings encephalopathy associated with deficiency of which vitamin? Vitamin A. Shilling or malabsorption of vitamin B12.
ഫുൾ സ്ക്രീൻ ഒന്ന് ആക്കിക്കോ കേട്ടോ.
Interventricular system heart. Okay. Interventricular system of heart is supplied by anterior part of left coronary artery and posterior by right coronary artery. Right coronary artery supplies all except apex of heart. Autosomal dominant disease among the following is tuberous sclerosis. Autosomal recessive disease is Wilson's disease, which is not an X-linked disease. Thalassemia is not an X-linked disease. Type 4 hypersensitivity reaction is TB. Dermatomyositis is type 3 hypersensitivity reaction. Contact dermatitis is a type 4 hypersensitivity reaction. Which of the following is a feature of Graves' disease? All are features of Graves' disease. Which of the following is not a feature of hypothyroidism? Heat intolerance is not a feature of hypothyroidism. It is feature of hyperthyroidism. Not an usual feature of hypothyroidism is menorrhagia. Malaria transmitted by Anopheles mosquito. Type is Aedes mosquito. Breeding habit of Aedes mosquito is in artificial collection of
വീണ
water.
ഒന്ന് ഫുൾ സ്ക്രീൻ ആക്കാമോ? നമുക്ക് യൂട്യൂബിൽ അത് സ്ലോ കാണാൻ കഴിയില്ല. യൂട്യൂബില്
Okay. Drug and Cosmetic Act in 1940. Sale of homeopathy drug comes under Rule 67. Rule 67E deals with duration of license. Aron sign present in acute appendicitis. Rat tail deformity seen in CA esophagus. Charcot striate contains pain, jaundice, and rigor. Unconjugated hyperbilirubinemia seen in Gilbert syndrome. Popcorn appearance is seen in fibroadenoma. Most appropriate contraceptive during first 6 months of lactating mother. It is IUCD. IUCD acts by aseptic inflammation of endometrium. DMPA is given every 3 months. DMPA is a contraceptive. Which vaccine is contraindicated in pregnancy? It is rubella. Vaccine in the universal immunization program aims at preventing blindness is measles. The adjuvant used in DPT is aluminium. Now, how to avoid negatives? Attempt easy question first. In the first round, attempt only easy question. Attempt those questions which are 100% sure for you. Read carefully the question. Be cautious of the word except, not, etc. Read all the options. Don't jump into answers immediately. Select the most appropriate answer. For example, option A and B only, option A only. In such case, we need a special attention for the options. Always avoid wild guesses. If you don't answer, skip that question. Okay. Out of 4 options, if we are down with only 2 options, then keep that question for a second round or keep it for review. Make an intelligent guess. Okay. Avoid anxiety and excitement. Okay. See, AIAPGET is not a big deal. Okay. So if I can achieve a good result, then you guys can also achieve. Okay. What you have to do is give your 100%. Okay, first give your 100%, definitely you will get a good result. Okay, and even after giving your 100%, if you are not getting, then leave it. Okay, there are so many other career options also. Okay, don't give so much pressure to yourself. Don't be so much excited or don't give so much tension by yourself. Okay, trust yourself. First, trust yourself. Don't ever compare yourself with others. Okay, try your best. Okay, take necessary break in between studies. Okay, so you can study, you can read some other books, or either you can cook, either you can sleep. Okay, either you can listen to music, either you can listen to some other things or watch movies. Okay, and no need to study from morning to night at a stretch. Okay, give necessary break in between your studies. don't be panic. There is enough time. 1.5 months is enough for a good revision and for a good result if you are giving your 100%. Study step by step. No need to study all the subject daily. Try to study 4 subject daily. Okay, at least you have to read 4 subject daily and do at least 1 or 2 question papers daily. Okay, and try to do a fruitful revision. Try to make your own timetable and do accordingly. So that's all regarding the preparation. And one more question is how most aspirants are asking this question is how many questions you want how to attend to achieve a good rank. Okay, so to be very frank, I don't know actually, but what my seniors used to tell me was if you are getting a mark above 70%, then there is a chance of getting a rank within first 50. Okay, if you are getting a mark within 60%, then there is a chance of getting a rank within 100. Okay, but I am not sure. Okay, in my opinion, try to attend 80, at least 80 questions. At least 80 questions correctly. Okay, if you are attending 80 questions and all the 80 questions are correct, then you will definitely get a good rank. Okay, and always try to avoid negatives and eat properly, sleep properly, and study properly. Okay, and all the very best for all the aspirants. Trust yourself and do your best. Okay, thank you.
Dr. Veena, it was really a wonderful and useful section. On behalf of IHMA Kerala and IHMA School of Homeopathy, I extend a really hearty vote of thanks to Dr. Veena, who spared her valuable time from her busy schedule for this webinar section. Today, we had an opportunity to hear her thoughts, and I think this will surely be going to encourage the coming combatants who were preparing for AIAPGET 2022 this year and also the coming exams. So thank you, Dr. Veena.
Thank you, Dr. Kavya, and thank you, IHMA, for such an opportunity. And thank you, all the guys who are attending this seminar, and all the very best for all the aspirants. Do your best. Okay, give your 100% and do your best. Trust yourself. Okay, so all the best. Thank you so much.
Okay, thank you. So everyone, our next session will be on next Sunday, and see you all on the next section. Till then, this is Dr. Kavya